doctorate in nursing really leads to endless possibilities in the profession. While we might have all started at the bedside as registered nurses, it's really only the beginning, and a doctorate takes you to many different places. The curriculum is also delivered in a distance education format. This is a huge benefit to our students because often our students will work either full-time or part-time, and so they can pursue the program in a distance ed capacity whereby they're only required to come to campus twice a semester. When we accept a student into one of our doctoral programs, we make a commitment to that student to ensure that they're able to reach all of their goals that they have for themselves. For a faculty that really truly values learning, it's our goal to ensure that we're learning from the students and the students are learning from us, and so it really is a collaborative model.
We educate DNP and PhD students collaboratively because we think it is important to view nursing knowledge as scholarship. So there's the research piece and there's the translational scholarship piece. And if we have those two branches of scholarship working in tandem from the beginning of your education, we think that you're going to have a much more powerful product.
One of the main things that sets us apart is the specific foci that our faculty have expertise in. We have the most sophisticated simulation lab of any program, at least in the United States. We also have a long-standing interest in the needs of people who are aging and at the end of life, and this is a huge concern in the research community in this country and others with the aging population. We have some of the nation's best scholars in health policy. We also, of course, have strong concern with all kinds of caregiving for patients, both physically ill and mentally ill, in ways that we can make sure that the latest research addresses their needs.
So I get asked the question a lot, why would you opt for a DNP when the MSN is still readily available at a lot of programs? And I certainly understand that thinking, but I think it's part of the way that nurses shortchange ourselves. You look at the amount of work that a doctoral program requires, you can see that our MSN students, in many cases, were doing almost as much work, with the difference being perhaps that they don't do a project or some of the coursework is slightly different. If you're already going to do that work, why not get the credit for it?
The national trend now is transitioning the advanced practice registered nurse degree and the executive role from the master's to the DNP. There was a report that came out in 2010 that looked at doubling the number of nurses who had doctoral degrees. Therefore, why not be at that level of practice for advanced practice nursing?
In my mind, the benefit of delivering nursing education online is the ability to reach clinicians where they are as they want to advance their education. Tennessee is a largely rural state. In fact, so many areas of the country are rural that it's really difficult for clinicians to leave their place of work and their home to go and get education. But if we can find a way to deliver high quality content in a distance education format, we can reach out to people everywhere.